anti yam fiber boy. I bobo your home by near to me at nursing. I should do more asumo. When a corner, when a exercise over Yamaya. Why don't know more bounty? Wait, let's say, Jesus Christ, amen.
Amen. Amen. Ma Christina Mishra. That's by body did me the near my. And I said, no October, the month of breast cancer awareness. Tinyame so I don't say we doctor. Doctor Wayade pa wakase free Ghana. Tia time ya. What to know so no ma just say. Doctor Yada Manabroso. Now, when you are a Dusia Pen, Tiway, suddenly way re-education. Nidin de Dr. Apna Ade. She's an MD, PhD candidate or specializing in breast cancer. She has a PhD in oncology. On Omame Hospital, it's a idea they are very passionate about educating women about breast cancer. Things of Mami Wasimboka say early detection saves lives. And today we have in our midst Dr. Apna Ade, say educating about breast cancer. To Dr. Pipacho, say why you ready a major platform has shown sir. Don't forget Ghanaian yada was say what's so na usu beche. I mean sure you can take over. Thank you.
Thank you.
Pacho, yeah.
Pacho, me try to share my screen. So today's topic is on breast cancer health education and specifically holistic care. And holistic care, yeah, BVA. Yes, say ye treaty obana enye edro keke. And wasem nieka nye treaty ne se woman no saying na ne hotie. Pacho muhu mi screen.
Me pachane yeah, you hope.
Okay, so I had describe holistic care as treatment of the whole person. So not just medication na ye de bemanon. And breast cancer is a big problem because in Ghana, for example, we have the two as number 1 and number 2. Breast cancer number 1 and cervical cancer number 2. Into these two things, in 2020, WHO found out that 45% of children who lose their mothers, so they become what we call maternal orphans. So ebia ne papa ho, ebia ne papa ni ho, but women na ewu ye no is from 25% breast cancer and 20% cervical cancer. So that's why it's a big issue at the BI breast cancer and cervical cancer. So right now, I'm in cervical cancer kakra. This year, for example, I did my pap smear. So pap smear no, is not done as commonly as your breast cancer screening. And no my this year. Next time I may no, within 3 years or in 5 years. It depends on the type of test that you do. So your bar, you find out from your gynecologist which type of pap smear and they'll also be able to tell you when next your screening will be. So it's either in 3 years or in 5 years. So breast cancer is the most common cancer diagnosed among women worldwide. And a man with breast cancer. So 3 to 5% of all breast cancer cases will be men. And worldwide, breast cancer is number 1. So in Canada, in Ghana, any other place in the world, breast cancer is the most commonly diagnosed cancer in women. We don't have a cause for breast cancer yet. We don't know what causes it. Cervical cancer, we know what causes it. It's caused by a virus. So there is a cause for cervical cancer, but there is no cause for breast cancer yet. So all that we can do is screening. Screening is the best thing to be able to solve the issue of breast cancer. And every woman is at risk. I will list risk factors later. Faho risk factor no obi oho be check risk factors ni bebre. Nso yem diagnosing with breast cancer da. Obi nso oho a risk factor no bebre ni ho a ebe apply to ono, but still ebi ono ne benya breast cancer. So the only important risk factor is being a woman. Every woman is at risk. Inti once our banned de nufo ne wo ho a there is the risk that ebenya breast cancer. So in Ghana, our general population, these are GlobalCan figures. So globally, they release a list. Ghana, every country is there. You just type GlobalCan and the country that you want. And the latest figures we have are from 2022. So the general population in Ghana is 32 million with some. General population in Canada is 38 million and some. The female population out of this general population is 15.9 in Ghana, and that percentage is 49.3%. In Canada, the female population is 19.3 million and is 50.3% of the whole population. Breast cancer figure, your diagnosis in Ghana, GlobalCan stated 5,026, and it forms 31.4% of all cancer cases in women. So cancers are GlobalCan cancer Ghana yinya no. Uche mutre, one chunk breast cancer. That's how heavy our figures are. In Canada, my numbers are 31,823, and that forms 23% of the female cancers. So there is an issue in Ghana, what we call National Cancer Registry. We don't have. So GlobalCan used, there is only one registry in Ghana, GlobalCan LSTA, and it's the Kumasi Cancer Registry. Ohe Canada and Swa registries are listed. I guess for you guys it's called provinces or something. As Obia womb. So everyone has their own cancer registry, and then they pull it together to make a national cancer registry. So for a cancer registry to be recognized, there are lists. You have to fit that criteria for them to mention you out. So in Ghana right now, just one is listed, and we don't have a national cancer registry. And OHE figures now, it's not that vast. The female population in Ghana and female population in Canada, difference in but look at the diagnosis here. So there is a group of people that they also wonder, say, is it possible because we don't have a cancer registry, our numbers are way too low because we are not registering them? It's also possible, say, for example, obi yare breast cancer onko hospital. Inti ye unhu krase nye hanon breast cancer. Inti sa nipa ne sanso ye unhu se ne number mba figure wemu. Because we are 15 million compared to 19 million, and diagnosed women is 5,000 as opposed to 31,000. So that is something else we are also talking about now, that we need a national cancer registry in Ghana. So breast cancer, I'm coming to list risk factors. Nothing on this list causes breast cancer. It only increases your risk. And again, I'm mentioning someone can be here or better boxes and Tracy obenya breast cancer. It just means your risk is higher. Inti wosa na osu weni ba ohoso. Obi ohonso a boxes ni bi ohon teke, but still ebia obenya breast cancer in her lifetime. The most important risk factor is being a woman. That's all. So if I'm you, I'm listing this because we study it. You should know because it increases your risk. But it doesn't mean, oh, me, I'm young, I'm a woman, that's all. That's the only thing I take here, so I'm not part of it. Anyone can get breast cancer if they have breast tissue. So the female gender is the first thing. The woman is more at risk than the man. Age, the older you grow, the more the higher your risk. Early menarche and late menopause. Menarche is the time that you start menstruating. Inti se wo starting tem na wa menstruate sa ebe chance na wo wa menopause o be fall into this group of starting menstruation early and you went into menopause late, so your risk will increase a little. Alcohol intake increases your risk. Excessive body weight increases your risk. Lack of physical activity. So all these things that I'm mentioning, alcohol, body, it's called lifestyle changes that you can make. You can change them. But being a woman, you can't change it. Growing older, you can't change it. But this you can change. And once you change alcohol, excessive body weight, physical activity, it also affects a lot of other things, diabetes, hypertension, all the other cancers. These things are also not good for them. Not having children. So women who do not have children have a slightly higher risk of developing breast cancer. If you have your first child after age 30, your chances also increase. If you do not breastfeed, your risk also increases. Breastfeeding has been proven to protect the woman. So we advise that if you can breastfeed, some people cannot breastfeed. That's a different issue. But if you can, we advise that you breastfeed because it protects the mother and it's also the best source of food for the child. Some hormonal birth control increases your risk because of the hormones. Before I'll be called birth control, so you need to go to a hospital so that your obs and gynae doctor will be checking all these things, say, how long can you be on it? What's the best one for you and all that. Menopausal hormone therapy, it also increases risk. So all that, the doctor prescribes it for you with all these things in check, looking at you, the one person. And then there is a rare type of breast implant associated breast cancer. I've listed the name here. So it's very rare. There was a case in France and it's documented where company na a year breast implants and had to call everyone that they did it for to come back for them to replace it. It doesn't happen often, but there is a possibility. So we also advise, we don't say go and do breast enhancement, but if you have to do it at a certified place so that whatever they are using is healthy for you as well. Family history. So if breast cancer has been in the family before, especially below 50 years, there is also a chance that it is because of a genetic mutation. Even with this, only 10% of all breast cancer cases are from this. So the other 90%, obia fie ne bin ni ho. Inti wonka say, oh, me fear breast cancer ma ho denti me emfa me ho. The majority is from enkrofo a omu fie na breast cancer emma hoda. Dense breast tissue. So we screening na mammogram ubehu say breast no eye dense and I say enye dense. Say dense doctors na nim so e was so many about so because of risk for breast cancer ekosro kakra. Ena say oba nenya breast cancer dada, her risk increases, said the other breast, ebetimi breast cancer biome. And there are also other types of breast conditions are enye cancer. So when you have bibi wo nufumu na enye cancer. So bibi for ba, there is a chance that no betimi cancer. And the fact that unya bibi enye cancer no, and unsu timi increase your risk. So we say this a lot, say breast cancer is a complex disease. And yet disease back home. See, a breast cancer, there are so many different things I was here looking at, which will determine the type of treatment, the type of medication, and all that. There's triple negative breast cancer, lobular breast cancer, inflammatory, some metastatic, a spread the out of breast, a drew stage bang. All that comes into how we treat the patient. Genetic mutation, I believe, say, BRCA1 and 2 is the most common, but there are other types, CDH1, PALP2, TP53.
I think Doctor, I lose connection to me. So man of America crying off and sign it back on. Me pamacho ni di mwa abra ye twen say Doctor Besaba back no. Besro obi betime ma yenwum ama ye de atwen doctor. I think say nana majimai. Me pacho ma yenwum emfa train doctor why Mr. Okay, I think say nana man it's my Nestina. Me pacho we de me nsa me so ma ye him ba ko mfa train doctor. That's a high din kakra. Oh, okay, Doctor Abantino.
Yes,
Okay.
sorry, my
Okay.
laptop, now my doing some charges. So I'll just continue now with my phone. So I was talking about breast cancer. There are different types. Into say, yeah, even 2 people breast cancer diagnosis are. It depende obiara ne ne type any how a nipa no be go through the treatment. Obi ohwe be be starting with surgery and some back chemotherapy. Obi ohwe be starting with chemotherapy. Obi ohwe nso a onya chemotherapy. And specifically with the genetic mutations. First, na Ghana yenye kra wo ha, but now it has come companies have started reaching out. They now do it here. And it's expensive, mom, but it's available now. As compared to first, not just a shipoko, either India, Turkey, and it was only for Omon me afford it to ship their samples out. But now we're also getting there. We were recently trained by Columbia University in New York on genetic counseling and testing, because before I will bet me a testy woman, no, you need to do genetic counseling with her. So all that is coming up for us now, and it's part of what we call holistic care. So we are not just doing part of the treatments, but everything. The next thing is, before we go through everything, let's come to how to know that there is a problem. The first advice we give the woman is say, most of the time, better see signs and symptoms of breast cancer. You try to advise you, say, screen yourself, because signs and symptoms are a trusted BBA for some time before it may show someone who said there is a problem here. So the best thing is you yourself start knowing your breast, and you can do that by screening yourself every month after your menstrual cycle. So menopause mudada, we advise say it be a first day of the month so that obekai, because untimi nyusu o cycle nimfanya reminder biom. Inti first day of the month and also last day of the month. Sada no na obeye screening. But se unyandru menopause every month after your cycle, you do your screening. Before the cycle, no, the breast goes through some changes. Into young advices as our time known as screening. And as you do the monthly screening, you will start to know how your breasts feel like. Into the least change, beba unufunim no, obe feel something has changed here. Sometimes ebia won san and feel it lump. That's the most common change. Say be round, badjua da unufunim. Normally, badjua bia ninufunim. So also nufunim say ya. That's when ebia mami foni bika say oh nufunim bobo ban bibi dem dada. But yes, you breast screening. Oh, yeah, breast screening now. Oh, your left breast now. Or left hand, to expose the breast. And you are supposed to touch your breast to your chest wall. You don't hold the breast itself. You are supposed to firmly touch to your chest wall and go all around it. Make sure you screen every part and you go into your armpit. So sometimes lamp or not change be a beba phone. It may not be big enough so on sa ebe feel. But every time breast cancer happens, or even sometimes inflammation, the first place ebe move your lymph nodes, and the lymph nodes no, there is some in the armpit. So if you are one feel phone, but for armpit there is something hard there. It's also something to send to the hospital. You don't have to wait. What we have with breast cancer is that the earlier we see it, the best results we get from treatment. So in the US, for example, early detection and prompt action, you're treating in term, there is a chance, a 98% survival rate for the first 5 years. In Ghana, some of our studies even go as low as less than 50%, but we are still picking up now, and data is now also coming up. So the only important thing with breast cancer is it should not have spread out of the breast. The breast is not a vital organ. Nufono and tise ebia wakuma anase or lungs. You don't need the breast to survive. So bibi ba nufuo nim a yetimi yi nufuo no anase adekode na aba nufuo nim no, and the woman will live her life afterwards. And that's the only issue we have. So breast cancer in free nufuo nim a, it is curable. Once a be free nufuo nim no, it is now stage 4, and we call that metastatic breast cancer. It drew that stage now. We don't treat it, say, yeah, cure woman. We do what we call palliative care, so care to make the woman comfortable. Even with that, there are women who have metastatic breast cancer and they've been alive for years. October 4th, we had our breast cancer walk, and triple negative breast cancer woman by Ofri US. She's metastatic or drug trials. I think some of you will know about that. And she's still here, she's still alive, she's working, she's fine. So it's not a death sentence for anybody, but we just know that when it's metastatic, there is a problem of we can't cure it. But as to when something will happen to, we can't say. So we don't write anybody off. Another thing with holistic care now is that with us, we've started doing things with our survivors. So October 2024, we had our very first breast cancer survivors retreat, where they went to a beachside resort, 10 breast cancer survivors. And February 2025, for World Cancer Day, we had our second one. So we have also started doing things that are what we call supportive cancer care. And that is non-medical health, that the woman's mental health, she's also fine, that she's well with the treatment, because it's a very difficult treatment. I was talking about screening before I came here. So the types of screening that we have the self-breast examination. That's what I just showed you. Screening yourself every month after your menstrual cycle, or you just choose a day, first day of the month, last day of the month. After that, there is what we call clinical breast screening. Clinical breast screening, no, obi a ya training no, doctor, nurse, health professional, ya training no send you be screening. And ono na ye screening ne ma. That's clinical breast self-examination. Ideally, no, we say at least once a year, somebody trained should examine you. So apart from breast self-examination, it was so year every month. No, obi a ya training no and examine wo. Every 6 months, once a year, at least once a year. There are people maybe call my story or say, oh, 3 months ago or 6 months ago, group be by my yebi. It doesn't matter. And it takes less than 5 minutes. So it doesn't matter how often. Once you get the opportunity, let somebody who has been trained screen you. Apart from that, we have breast ultrasounds. So, and no doctor never requested for an ultrasound for you. It tells us say ebia bibi danu for ni madekode no a liquid like insuana say hard, and it will further prove how we go about testing what is in your breast, or is there a change at all. It will also see lymph nodes never wamutuom no ayedendin or hot, all that no ultrasound a bit me tell you that. Then we have mammogram. Mammogram is for women over 40 years. It's not very sensitive for younger women. Most of the time, no, it's after 40 that we do mammograms. However, in certain situations, sometimes doctor be requesting mammogram for a woman who is not 40 years, but it depends on nipani situation. But otherwise, normally 40 years and above. If webusiemu breast cancer bahoda, sometimes we'll start a mammogram at 35. So all this, in conversation with your doctor, you know when you start your mammogram, how often you do it, every 2 years or every year, all that will come up. And then you're free and know that is how to screen for anything wrong with your breast, not just breast cancer. Because before we can say obi what breast cancer, no, there is only one test that will confirm it, and it's called a biopsy, called needle biopsy, or sometimes excision biopsy, where you betcha at the codino at the lab. So it's only the lab and the day reports this is breast cancer. Apart from that, there is no other way to tell that something is breast cancer. So we say anytime you see any change, just go to the hospital, because on your own, known to me who say cancer and I say any cancer. Treating breast cancer, there are different things to do. There is chemotherapy. Chemotherapy, to say you didn't see so hospital, but a cancer medicine. And there are different types of chemotherapy. There are different side effects depending on drug potting. how many cycles, how often. All that depends on the type of breast cancer. And from that, we will know what it will respond to and which chemotherapy the woman will need. Chemotherapy, most common side effects, for example, ASA obani belusuni trinui, obeye tuntum. Sometimes feelings when insomnia and nurse will go. So all these things we try at the hospital to give medications to help these side effects. But once the body will replenish and everything will come back to how she was before she went through the chemo. And if there is a need for extra help to help her body recover, that will be done for her. There is surgery. Surgery, there are two types. So breast conserving surgery, where you be cancer nipe, and now say mastectomy, you be nufonina. How are you choosing? It depends on a lot